Good afternoon. My name is Krishan Kadiraman, and I would like to talk about a topic that is very important and yet is not discussed very often. Why are there so many autistic children born? And why is this number higher in dark skinned or immigrant mothers? In the past decade, there has been a decrease in the total number of deaths for children. In the year 2000, the number was 9 per thousand kids that died. This number has decreased to 6 in every thousand children that die. Unfortunately, the data on autism isn't such happy reading. Autism is a neurodevelopmental disorder characterized by impaired social interaction and stereotypical repetitive behaviors. According to the CDC, in year 2000, there were 1 in 66 children were born with autism. By the year 2010, this number has increased to 1 in 60. And if you are dark-skinned, wear a veil, or an immigrant, that number could be as high as 1 in 40. No one is still completely sure about what causes autism, but a recent study has found a link between lower levels of maternal vitamin D and a higher increase in autism. This is due to 3 mechanisms. 1. A genetic susceptibility to autism can be activated by a vitamin D deficiency. 2. A vitamin D plays a role in DNA repair, so an insufficiency could lead to higher mutations. And finally, vitamin D has been shown to protect against fetal brain defects. So why is a lack of vitamin D more common in people of darker skin or recent immigrants? The typical Western diet is very low in vitamin D, and as a result, most of the vitamin D required has to be absorbed from sunlight. People of darker skin require longer exposure to sunlight to absorb the required amount of vitamin D. Especially in colder climates, this is not easy to achieve, when usually for around half the year we are bundled up on multiple layers. Currently, vitamin D levels are not screened for at prenatal doctor's appointments, as this is a relatively new theory. But every patient has a right to ask their doctor to order a blood draw to test their vitamin D levels. As a nurse, 2 of the key components of my job will be patient education and advocacy, and I would suggest to any nursing student seeing this to take it upon yourselves to educate not only the doctors that you may work with, but also your friends and family who are thinking about having a baby. There is currently no cure for autism, but if there is any way that we can prevent it, we should strive to do so. If we can all spread the word and educate people, hopefully we will see a decrease in autism. Thank you.